Hi, my name is Dr. Isabel Commandra. Today I'm going to answer some frequently asked questions about oral hygiene and home care.
First question is, how often should I floss my teeth?
So ideally, we should floss at least once a day. There's some difference in opinion between whether you should floss at night or in the morning. The most important thing is being consistent and regular with it. So as long as it's once a day, that's the best for preventing inflammation.
Question is, how many times a year should I get my teeth cleaned?
So everybody is a little bit different. We're all individuals. We have different habits. We have different bodies, different health, overall health. So it always depends on the person. It can be anywhere from once every 6 months. It could be once every 4 months, once every 3 months. And the best way to determine is just to see your dentist to figure out what they would recommend as the best frequency.
Question is, are electric toothbrushes better than manual brushes?
So I personally really highly recommend electric toothbrushes. The reason for this is electric brushes have that vibrational motion that helps to act like a massage for the gums. When we're brushing our teeth, so one of the goals is to clean off any biofilm that builds up on our teeth, but the secondary goal is to help prevent gum inflammation. And with this vibration and the massage really helps maintain that. It also gives you a much cleaner feeling after you brush. And some of the electric brushes that I really do like are the Oral-B Pro Health line. I also really like the Philips Sonicare line, some of those rechargeable ones, especially the ones that will time you, because that's probably one of the best benefits is usually when we're brushing with a regular toothbrush, we don't really keep track of how long we're brushing for. So some of the really good electric brushes, they'll time you, they'll buzz every 30 seconds, so we should spend 30 seconds per quarter of the mouth.
Question is, how can I prevent gum disease?
So the answer to this is a little bit boring, but it's just being consistent. So consistent with your home care, which means brushing at least twice a day. For sure, before you go to bed, after you brush before bed, don't eat or drink anything other than water. And then in the morning, when you wake up, brushing that second time, so twice a day, and then flossing, at least once a day. Anything above and beyond that, like mouthwash, or the rubber stimulators, the interproximal brushes can be extra or a bonus, but those are sort of your bread and butter way of taking care of your teeth. And then of course, seeing your dentist at least once every 6 months just to get a check and make sure everything is okay.
Question is, why do my gums bleed when I'm brushing?
So bleeding of your gums when you're brushing, this is a sign of gum inflammation. Another word for this is gum disease or gingivitis. The reason that's not healthy is it's your body's way of telling you there's something that your gums don't like in your mouth. And typically what that is a buildup of bacteria. When you have that bacteria sitting close to the gum line, it triggers your body's immune response, which then triggers a bunch of inflammatory signals. And what this basically means is when your gums are bleeding, they're open. They're an open barrier between your body and your mouth. So if blood can come out of your gums, bacteria can also enter your bloodstream from the gums. So that's why we are always so on top of preventing gum inflammation.